In the United States, healthcare is a major problem. Many Americans cannot afford the high insurance premiums, and with the current economic struggle, even more Americans are being forced to drop their healthcare insurance. In Gainesville specifically, healthcare issues are manifested in race and poverty.
What do you think the biggest issue in Gainesville is, regarding healthcare?
Gainesville, it is probably the distribution of healthcare resources. If you look in East Gainesville, east of 13th Street, there are no doctor's offices. And then if you go out to West Gainesville, there's essentially a Section 8 project housing complex that has no doctors, but you go a few blocks west and you enter Hale Plantation, which has more doctors than you know what to do with. So it's just the spacing and location.
Do you find that there's a trend in who doesn't have healthcare and who does have healthcare?
Absolutely. The poor people don't have healthcare. Rich people do. That's why Shands AGH right next door, it was torn down because it was in the poor half of town and they just couldn't pay their bills.
Do you find a correlation between races of people who don't have healthcare?
Yeah, usually minorities tend not to have healthcare, and that usually goes along with the same tendency to have lower income, lower educational level. It's all pretty well correlated.
If you go to the doctor and they'll help you out, or if you go to dentist and stuff and they'll help you out.
I have no idea, how to answer that question. Like health services provided by the government? Yeah, more like doctors,
Fine, in general.
Going to a doctor, healthcare, taking care of your health.
Okay.
I really don't have.
You don't have any?
Any views. I don't know a lot about it. I don't have any.
You don't have any?
I think that it should be done for everybody, but I don't know if it's it's worth it, because it costs a lot of money.
Right.
So I don't know if it's worth it, but I think it should be done.
I think it's alright.
I think it's a privilege.
Okay, why do you think it's a privilege?
Because why should everybody else have to pay for something that you can't afford for yourself? If you have a job, then you should get health insurance. If you don't have a job, then it sucks. You don't get health insurance.
So you don't have insurance,
I believe everyone should have it because you need it.
Yeah.
But a lot of people can't get it because of the economy, how it's troubling. But you have to rely on family sometimes too, to help you out with friends, and just get a job and figure it out sometimes.
Definitely right. Yeah. I guess my personal motto at the clinic would be we don't turn anybody away.
According to the Centers of Disease Control, in 2010, 15.4% of the U.S. population is uninsured. According to Well Florida, in 2008, 28% of the Alachua County population did not have insurance.
No.
And McDonald's doesn't provide you with health care?
No.
Are you a full-time employee?
Yes. I work 60, 70 hours a week.
And you don't have health care or health insurance?
Not through McDonald's at all. They tell you straight up no.
In Gainesville, establishments like the Equal Access Clinic help to provide health care to those who cannot afford it.
What are your goals of your organization? Can you just tell us a little bit about your organization?
The Equal Access Clinic's been open since 1992, and pretty much our goal is just to provide free medical care to the uninsured and underserved populations in Gainesville.
There are still many uninsured people who are not receiving adequate medical care. More strides need to be made to make medical care more accessible for all Americans, not just ones who can afford insurance. Establishments similar to the Equal Access Clinic need to be created in order to better serve the impoverished and uninsured areas of Gainesville.